So, welcome to today's talk. I'm going to talk to you today about homeopathy and its approach in one of the commonest type of diseases in today's time, which is related to stress. And we are going to talk about autoimmune diseases like ulcerative colitis. And ulcerative colitis is one of the commonest diseases in today's times. Ulcerative colitis and Crohn's together is also known as inflammatory bowel disease, and typically in this type of disease it's autoimmune disease, which means that your own body's parts start fighting against your own body parts, and there's like a reaction. It's called as autoimmune reactions, and this can be a very painful and difficult condition where there's a lot of dysentery, diarrhea, bleeding, loss of weight, emaciation. Patient can go into a very difficult condition. But the good news is that homeopathy has tremendous results in this type of condition, and I want to just share with you one of very good results in ulcerative colitis. Most cases that I've seen, 9 times out of 10 ulcerative colitis, homeopathy generally benefits the patient at different levels. So this is a case of a 55-year-old man. He came from Pune to see me, and he was diagnosed in 2014 with ulcerative colitis. You can see here his scans where there was proctosigmoidoscopy done, which showed a huge ulcers and bleeding, and he had a test done called fecal calc protein, which is 1373. This is one of the commonest tests which is done, and he was in a very bad condition. He was bleeding. He was admitted in the hospital. He was taking high levels of steroid, mesocol, Folvite. And in homeopathy, we don't stop allopathy totally, but we gradually taper it down. And once the patient is really benefiting, then we stop the allopathic medication. This is what we do. This is what I'd like to do in my patients most of the times, except for if I feel allopathic medicine is causing side effects. So when I saw him first time, he was bleeding. He was hospitalized. He was constantly. He was passing stool 10 times a day with bleeding, constant urging. He didn't feel like having food at all. He was sluggish. There was sour taste in the mouth, distension of the abdomen. He was in a very difficult condition. So in homeopathy, especially in autoimmune disease, we try to understand the person in the disease. So in this pathology, his main stress is what we have to understand homeopathy. So if you go to meet a homeopath, and I know many of you people who are watching are patients or relatives of patients, it's very important to tell your doctor what is the main stress before this started. The main stress for my patient here was a lot of responsibility on him suddenly, where he was unable to take responsibility. He was unable to know what to do. It was like a whole load of pressure on him, and he was incapable. This is the type of pattern we try to understand. And when I understood him as a person who's very shy, introverted. He's not able to take responsibility, and as if a whole load of responsibility on him, and he wasn't able to take it emotionally, mentally, and that later on caused this kind of issues and developed into pathology. This is important to understand how stress can affect the person's health. So understanding all of this, and in homeopathy, this is what we do. We try to go in different areas of person's life. For example, the nature, the fears, the dreams, the stressful areas, the crisis situation, the anxieties. Understanding all of this, we choose a homeopathic remedy, and that's what we chose, a homeopathic remedy for our patient here. And you can see here, at the end of 1 year of treatment with help of homeopathy, we were able to really reduce the allopathic medicine, and the fecal calc protein, which was 1373, is now 113. This is within 1 year, and now he's able to live totally a normal life. We have changed his lifestyle, we have changed his life patterns, and homeopathy can help very beautifully in most health conditions in today's time. So this is what I wanted to talk to you today about. I've not written about the name of the remedy, because one of the problems with people who watch my cases, they then directly use the same remedy. This is not true. In homeopathy, every person requires another remedy. This is a science of individualization. So I must have seen few cases of ulcerative colitis in last 1 year, say about 10. Every one of them required another homeopathic remedy. So there is no specifics in homeopathy, but the remedy for the person. So write to me, and if wherever you are, you can either write to me or find a good homeopath and take a treatment from him or her.